the time, training, or the inclination for strategic thought.
Let's play replay.
Knowledge.
Daddies.
The Wicker Man.
Yeah.
Yeah, it's like the first time I saw it. It's a horror, folk, like musical, like movie from the 70s. It's super bizarre.
Yeah, I watched that through Oscar's window while he was watching it.
That sounds cool. I want to watch that.
Yeah, it's bizarre. There's a lot of music in there. It's really funny. It has like Monty Python vibes.
Yeah, I've only actually ever seen the Nick Cage version where he's just screaming like a lunatic for an hour and a half.
Oh, there's a Nick Cage version?
Yeah, you never seen the Bees?
No.
Not the goddamn. I don't want to scream. He's in a house, but he screams. Not the goddamn bees. It's good. Look it up online. It's excellent.
All right, I've been fiending for more Nick Cage in my life lately.
You've been talking about that recently.
Yeah.
I don't think this is doing anything.
Is it because Vinny said that's the type of actor you are? Is it Nick Cage level?
No, he didn't.
Which for the record is you'd actually, if you could get a Nick Cage angle, you could be good at that. It's like
what is his angle?
Well, he purposely goes as over the top as like it's a true his acting style is these big abrasive over the top zaniness to him, and it works for his acting method.
I've heard him called like the worst best actor.
That's probably a fair, but like you watch him, you're like sometimes depends on the movie, but like it can work for him.
I think he's a good actor. I don't think
he's bad. He's won best actor.
Yeah, I think he's a good actor.
All right. Well,
yeah.
I'll try. Anyway, let's get started, guys.
Let's get
I like how you're on your best behavior right fucking now. This is not how you fucking do any other podcast we've ever done before. But because of who our guest is today,
I love it.
Yeah. We might need to make you be on every podcast. He never behaves like this.
I did. I made some demands, definitely.
Yeah. Got it. All right, let's reveal this little tidbit. Let's get our viewers and listeners behind the scenes thing. Andrew texted us yesterday. So, guys, I think we should all prepare questions ahead of time for each of our guests. That way we can all be more inclusive in the discussion during this time. You know, Frankie said it'd be a good idea. Despite that, I have been mentioning this for fucking months since we started doing this. I said, hey, maybe we should prepare what we're going to say. And Andrew goes, nah, I don't want to do that. I think it's better when we just let me do a better Andrew. I don't want to do that.
Listen, man, why don't you take the initiative for once and get it going and start it?
I do start the podcast all the time.
No, I'm not saying the podcast. I'm saying like the questions going back and forth. And by the way, you were the only one who didn't send in any questions.
Well, yeah, so, I saw your guys' questions. I'll ask my own.
Yeah.
We want to see yours.
we have prepared questions in the past, so
our one time.
Anyway.
Like we have, in the past.
It's not about us. This is about this beautiful angelic woman.
He says that about all of our guests.
Yeah,
even the male ones.
Yeah.
So I was thinking about so I can't take credit for all these questions because Eva sort of helped brainstorm with me.
Even the ice one?
The ice one?
Yeah.
Oh, well, we'll get to it. There's a few icebreaker questions, pretty much. They have thrown in there. And the first one was, which Spice Girl do you identify with?
Yes. Are we starting? We're starting right now?
No, we're not starting right now. Again, this is the problem. We don't fucking have
we gotta say, okay, first off,
welcome to the Knowledge Daddies podcast, everybody. My name's Sean. Joining with me as always is
Oscar.
And
Andrew.
With our guest.
With a very special guest today.
Oh, how should I introduce myself?
Moonglord. Moonglord.
Well, Francesca Maglione, as your Francesca Maglione, if you want the full thing. But you guys can call me Frankie.
Nice.
You guys are my friends, so my friends call me Frankie.
Yay.
Yay. And we're on.
Yeah. This is the level of professionalism that we have for the podcast. So yeah, we're here with Frankie, and she's studying oncology. She's studying to be a dietitian for cancer patients.
No, shut up, Oscar.
All right, Andrew.
I can't explain. You go ahead, because
Frankie is an oncology dietitian. She's also studying to get her master's in related what the field?
Public health.
Public health. And yes, how long have you been doing it?
5 years.
Good. That's nice.
Yeah.
Now, Frankie, I really like from when we started dating. I've always respected the fact that you have the profession you do, because it seems like such a difficult profession and such a giving profession, and I want to get to the bottom of that. And also,
that's not true. After your first date, he said to me, he's like, yeah, she does this really dumb job. I don't even know what it is. He's like, I think this is so stupid. He said that to me. I've written down my dream journal.
Yeah, I said you force feed cancer patients like geese for foie gras processing.
Uh-huh. Yeah. So I guess, yeah.
What's in your diary about that night, Oscar?
Mine was, what is an oncology dietitian? And I actually had to Google that, because first of all,
you should be able to put the two and two together. That's a pretty.
Well, I forgot what an oncologist is.
A lot of people don't know what a dietitian is, so
Is
that's fair.
Studying the Egyptian symbol of the Ankh.
Yeah, you're on the money.
Yeah,
you're on the money.
Okay, all right. Let's get a little serious for a second, because it is actually a really important and interesting profession that you're into. So, you don't mind telling our viewers, our viewer. I'm not gonna say viewers. Our viewer. What does an oncologist dietitian do, and the general perception behind it, please, and thank you.
Thank you for that lovely question, Sean.
I know. I'm sorry, he's always charged with anger. They do this to me. I'm so calm.
It's okay. You're good. All right. So what I do is, all right. So dietitian is basically we provide medical nutrition therapy to patients. So just like you would maybe see like a physical therapist for like a physical problem, you'd see a dietitian for a nutrition problem. So in my case, the patients that I'm seeing have cancer. So I'm helping them manage their symptoms from their chemotherapy or radiation or bone marrow transplant. Or sometimes we're managing other conditions that they have that are like interfering with their chemo. So hypertension, diabetes, kidney disease, food allergies, like feeding disorders, that kind of stuff.
So how did you, first of all, get into nutrition, and second of all, focus in on oncology?
That's a good question. All right. So I wanted to be a nurse because I think I really liked science. I wanted to help people. But I also at the time was working in food service, and I was working at McDonald's. And even though McDonald's was a really shitty job, I kind of was like, I love working in food service. And I was always like, oh, when I'm a nurse, I have to like stop working in food service. That's going to suck. And then I took a nutrition class, because you have to take like a basic nutrition class as a nursing student. and it was taught by a clinical dietitian. And I was like, oh, I did not even know that was a job. Just like you guys were like, what the hell is that? I also was like, what the hell is that? And I didn't know that was a thing. And I was like, oh, food and helping people in science, like win-win, I'm in. And basically like just switched programs, like dropped out of the nursing program, took a semester off and went back to be a dietitian. And then as far as getting into oncology, I was always really interested in nutrition support, which is like people who have tube feedings, like tubes go into their stomach for nutrition, or like food goes through an IV.
Right. Yeah, you gotta explain too.
Yeah, I think we need to can you break this down a little bit more? Because I think when most people hear like nutritionist, they're thinking, oh, somebody who tells me to eat more vegetables and stuff, as opposed to the more, what's what I'm looking for here? I guess clinical level, right?
Yeah, that's okay. So tube feeding, I always say, like, I say everyone had a tube feeding at one point, and we all have like a tube feeding scar or belly buttons. So that was like the OG tube feed, right? So some people who can't swallow anymore, or something like they have their stomach removed, they can't eat by mouth anymore. It's called PO intake. And so they will surgically place a tube that directly goes into the stomach. Boom, that's your new esophagus. And you just put food, like liquefied food formula, through that. So you get nutrition.
You know what my OG tube feed name was?
What?
Tube pack.
Oh, that's so good. I love that.
Yeah. And I have a little bit of experience with I guess they call it like a G tube, right?
Yeah, exactly.
Because my brother he has issues with his esophagus, so he actually has a G tube.
Yeah.
So
there you go.
and and we like give him I guess Nutrifiber, or those little
Nutrient
liquid
1.0.
Nutrient 1.0.
Oh yeah.
Yeah, and I was wondering, I guess for cancer patients who get to that point, I guess, or what type of, like, how does the cancer part relate to the G tube part? I guess like I know maybe if like they don't eat, they have to get a G tube at some point, or
Yeah, so that actually, and I was telling Andrew about this recently, and he didn't want to hear about it because he said it was sad. But typically, like children, so I take care of children and adults. So children will usually need it for that reason, just because like they're kids, it's hard for them to eat already. And so like to understand, like you have to push yourself to eat when it's hard is a lot for them. So it's a lot easier for them to just have a G tube. For adults, it's not often that they'll get to that point where it's just like, I just can't eat, so I need a feeding tube. Usually there's like a clinical reason, like someone can't swallow or they don't have a stomach.
yeah, because my father had cancer for a bit, and he his diet, he had like no appetite. It was that from the radiation or chemotherapy. I guess it kills the appetite.
Yeah, it could be from both.
From both, yeah. And yeah, they said it's like, yeah, if you don't eat, we'll have to do the G tube thing. And he was like, no, I'm not doing that. So they so it got him to eat. But are there other ways you could sort of get people to eat, or encourage people to have a healthy diet, people that are getting cancer treatment?
Yeah, definitely. But it's how old is your brother?
My older brother is 4 years older than I am. So he's 4 years older than I am.
Gosh.
34.
And so he has the G tube.
He has a G tube, but for other reasons when he was younger. So putting that in and doing all that stuff.
Yeah.
I've done a little bit of.
So it's interesting how like in that situation, like some people will see that and go, oh, this is just how I get my food so I can live and do the things that I want to do, or like have my life. But then when you put it in a different perspective, in like the perspective of cancer, a lot of people see it as like, oh, this is a failure, or this is something as like a last resort. And it's really not that, because like you said, for your brother, it's not like a last resort. That's just how he eats. But then for your dad, how it's like that completely different mindset.
Yeah, I would depress the shit out of me if I had to not eat delicious things.
it's hard, but I mean, it's better than
Better than dying.
alternative.
I
And you
don't
could
know.
put fun stuff in the tube. I had one guy who would always put like he would puree ribs and put ribs, and I would always be
Ugh.
like, how the hell is that not getting clogged? But he would puree ribs and all kinds of
That's
stuff.
disgusting.
Does it need to be like a super kind of like mush, or could it be in theory like a little?
No, it should be like liquefied.
Yeah.
Or you could put if you put alcohol through the tube, you get drunk real fast.
Ooh, I'd try that.
Yeah.
That'd be nice.
Put edibles,
You put
Edibles,
Bubbles.
cocaine,
LSD,
LSD, monkey seed.
Yeah.
mushrooms.
Be careful about what liquids you have laying around.
Yeah. So,
So, oh yeah, you go.
I'm a quick draw McGraw. You're gonna have to.
Yeah, we
go
know you
faster
talk
than-
over us all the time.
I didn't talk. He talked over me. Okay,
No, you-
I got
no,
there
You talk
quicker,
over.
and that's not my fault. That I have
That's
better.
true. You,
So, like,
you had the lead. You had the millisecond lead. I'll give you that one.
I'm sorry
I would
I'm
be
quicker
done.
than you. I'm sorry, my
I
tongue
just
is
prefer
more.
hearing your voice.
You may have been a high school athlete, but my tongue is quicker than your tongue. Okay,
Jesus Christ! All right,
but I also didn't.
Why are you
have a-
dating Andrew?
Get into the real questions now.
Yeah, well, this is what we're really talking about. What is all right? We can bounce around a little bit. Let's lighten this up from the cancer, not being able to taste food, all that.
I can tell you guys a funny story.
Yes, please.
To make it less serious. Okay, so I have to ask my patient because I was like, oh, this is gonna be so sad. I need to prepare funny stories. So even though I don't think it's sad, I think there's a lot of other sad things there's a lot of other sad things that happen in life, and people are very hopeful and inspiring and badass. So that's what I have to say about my patients. But I have to ask people about what they eat. So I do like diet recalls. So it's kind of like I'm a food detective. And it's really hard sometimes because people don't realize that like I can't see what's in their house. So a lot of times when I'm like, what do you have for lunch? They'll be like, whatever's in the house. And I'm just like, okay, come on, like what's in your house? So like that's like more typical. But there's this one time I had this elderly gentleman and I was going through the diet recall and I was like, all right, like what do you have for dinner? And then I said, all right, what do you have after dinner? And he's like, sex. And it was like his wife and the daughter in the room. They're like, Dad.
Oh my god!
But it was
Yeah.
so good. It made my day.
That's a very dad response.
Yeah.
Yes.
He was
Your-
like in his late 80s. He was
Your mama's
so-
butt cheeks.
I was like, you were
That's
definitely not
good.
having sex after dinner. I mean, maybe he is. I don't know.
Maybe he refers to napping as sex. I took a nap this weekend during the Masters, and I'm like, this is pretty good. This is just good.
And by the Masters, do you mean your marathon jerk off session?
See, why do you have to take it to that level? See, mine was kind of, I'm lazy, and then you have to make it this weird sexual dynamic to everything.
It's just because Masters sounds like masturbate.
It's a golf term. Most people know what that is. Freak.
I mean, I was thinking what you were thinking.
Oh,
I don't know anything about golf.
Alright.
Who watches golf
Or
anyway?
sex.
Lots of people watch golf. It's very popular. One of the people who watch masturbation sessions.
No, I'm saying you had a marathon masturbation session.
Yeah, I know what you're saying. It's just you didn't need to say that.
I didn't need to, but
I had a
wanted
marathon
to.
session editing your fucking sloppy work on the table edit.
Yeah. Anyway, moving on.
All right, I have one.
You can ask real questions.
So what type of nutrition like do cancer patients need, like in particular? In other words, like what does the cancer treatment deplete them of that they need?
Um,
I'll leave this to you.
you want to take this one?
Oh no, you got this.
Mainly they need extra protein because their body is doing a lot of work. So the cancer treatment typically kills cancer cells, but there are some casualties. So sometimes the other healthy cells get damaged and they need to they're rebuilding faster than normal because they're being damaged. And so all of that's basically made out of protein. So their protein needs go up. And then they need to stay really hydrated. So like lots of fluids so that their kidneys stay healthy and functioning. because like their kidneys are excreting, like they're dealing with a lot of extra stress. So all the chemo is a lot of stress on the kidneys. So staying hydrated is really important. Those are like the two main things. People always think there's like people have to do like special supplements or like crazy vegetables and all this stuff. And it's actually not that complicated during treatment.
So when it comes, so the pureed rib idea is actually a good idea.
Yes. Yeah,
Huh.
that guy did great. Honestly, he did pretty good.
Yeah. Wow.
You saying in past tense, did he die?
He finished treatment. So that's the thing, is when people finish treatment, I stop seeing them. So sometimes you find out what happens to them and sometimes you don't. But
Frankie, this is a question I had for you. Is like, what is your strategy for dealing with the fact that sometimes your patients die? Like, how do you deal with that emotionally? And also, how did you deal with that in the beginning versus now?
oh, that's a good question. Okay. So I initially started working in an ICU, like a surgical trauma ICU. So people were fucked up, like really badly fucked up. And it's like all of a sudden someone went out for a walk, they went to drive, and now all of a sudden they're right there in the ICU for months, whatever. And so I think going from that type of like tragedy and loss to oncology tragedy and loss is different. And I think it's actually a lot easier to deal with the oncology because not every situation is someone has cancer, they're going to die, right? You also have a lot of time, usually at least more time than getting into a car accident. And so I think that you're meeting people, all different types of people at a time in their life that is something maybe they'll never experience again. They've never experienced before. It's like really hard. And I just feel kind of honored to be able to support people during such a hard time. And just be able to like be a witness for their experience and be a witness for their lives and their stories. And you're kind of like their keeper, right? Like I'm able to tell stories about these people who may or may not be with us anymore. And they kind of like live on through that, which is really cool. And I remember when I first started, I think I wasn't able to accept people's maybe time that they had. Whereas like I remember this one old guy, he like knew that he didn't have a lot of time left. And I was so new in the field that I like did not want to stop trying things. And one day he just looked at me in the hospital and he's like, "You've done a great job. It's okay. Like I'm going to go home with my family and I'm going to be okay." And so the next day I just had like extra time after I saw patients and I just went and spent time and I just was like, "Hey, what's up? Let's just talk." And we talked for an hour and he just told me stories. I stopped trying to talk about nutrition, stopped trying to work on his tube feeding, and just let him tell me stories about himself. And that was maybe the most helpful thing I did for him that whole hospital stay. He went home with his family.
Beautiful.
Thank you. So I think it's a really special, it's an honor, I think. And I think that like we're all gonna have an end day on our lives.
Not me, but you guys.
And so it's like, it's okay. It's also okay to laugh. And I think sometimes being able to be like laughing with your patients and let them feel like they're normal fucking human beings and they could laugh and tell a joke and have a good time. Doesn't have to be so serious and heavy, right? Like it used to be when I first started, it was like very serious and heavy. I'm here to help you now. So I know now when
you're
I'm not
walking
going to
in
help you, but I
you're
could
just
be here
laughing
to
at all these
support
cancer
you.
patients.
Exactly. I could be here to support you and have a good time.
You could be like
Stand there
Nelson.
pointing at him like, "Ha ha, you have cancer."
You heard me start to tell that joke.
I know we were
and then
thinking
you
at the
just
same time.
fucking stole it from
I beat
me.
you by a millisecond. I beat you by a
interrupted
millisecond.
me.
I beat you by a millisecond.
Yeah. So I mean that's cool. I love talking about wigs. When people start to lose their hair, I'm like, so what kind of wigs are you thinking about?
Who's got the best wig?
Wait 1 second. And you didn't even do the right pitch for the ha. You didn't even go
It
there.
wouldn't translate over Zoom. It wouldn't translate over Zoom. What's the best wig you've seen?
I am a big fan of the wigs that are attached to a hat.
Rasta. Aren't those race? Those aren't culturally appropriate anymore. You know,
People are walking around with just a Rasta wig. They won it at a fair. That's how bad our health insurance is in this country.
Oh
Probably.
man,
Oh man.
a lot of Rasta wigs.
Yeah, I like the ones that though, like it'll be like a baseball caps. This one younger woman had a really cute baseball cap with like sleek long black hair, and I legit thought it was her hair.
that's cool.
I really like that
wow.
one. Yeah. Or some people get them like specially made to look like what their hair used to look like, which is a little freaky. And then my one friend, her mom, who's going through chemo, she experimented with like purple wigs, pink wigs. Like she got real funky with it. And so I like that too.
Yeah, Medusa had a hat that had a bunch of dead snakes under it.
It was actually her cancer wig.
Yeah.
That's really neat.
So, is there like, if someone was going through like chemotherapy versus radiation, would that require two different dietary sort of considerations?
Sometimes it depends on the type of cancer and the type of radiation.
What type of cancer has the best food?
Which type of cancer has the best food?
What's the best type of cancer to get?
What's the most delicious type of cancer?
And you can eat one
Whoa.
cancer. What would you get?
It's not colon cancer, right? You can't
DLBCL.
really eat.
I feel like
LBCL?
pancreatic cancer could
A
be.
You hear that?
diffuse large B-cell lymphoma.
Oh, I thought
That's
it was
okay.
I thought it was deli.
I think if I had to get one, I'd get that. You know, statistically
deli,
speaking,
What was that? Deli linguine, bacon,
clams.
clams, and lard.
Lobster, you fool.
Lobster. Yeah.
High
Yeah.
class.
Yeah.
Well, I mean, it seems like they all have ribs. You could eat ribs on all the cancers, right? Like if you're getting you need the protein.
Yeah, I feel like the better ones to have is honestly like a lymphoma is okay. Like a non-Hodgkin's lymphoma. DLB, large B-cell lymphoma. I mean, none of them are good to have. But as far as like what you can eat, those like the other thing is like there's not a ton of research on food specifically in those, and they're not obesity related. So there's just like less nutrition research in that area. So people with those types of cancers, like, what food should I eat? And I'm like, I don't really know because no one's really studying this.
I guess. Well, how
So-
on the broader span, just like, does our diet affect? You know, if you had a shittier diet, you're more likely to worsen cancer or have more mutations or something along those lines, or
Certain types of cancer. However, interestingly enough, it's not just about like, oh, bad foods, right? Like I always use the example that for people who have a history of smoking cigarettes, if they take high dose vitamin C supplements, they're actually more likely to develop a lung cancer.
Oh, yikes.
And a lot of people take high dose vitamin C supplements because they just think it's healthy.
yeah, Joe Rogan,
Yeah, I do both.
and he does
Ugh.
promote that a lot. Yeah,
Does he?
Yeah. However, people who are active current smokers do have higher vitamin C needs, but you just have to be careful with like, it's not much higher, but the issues is when we start taking like 500, 2000 plus % daily value vitamin C.
that's why I just chug a thing of orange juice every day.
Yeah. We don't need that much vitamin C.
Mm.
Yeah.
So what I'm
Yeah.
getting is 50 Cent and vitamin C are putting out a track together.
Yes.
I'm glad your jokes don't even land when you're in the room with the person.
so they have
I'm like, what?
so there's this, I guess, like there's this whole thing, I guess in the 90s, I just like using like formula to feed babies and versus like natural like breast milk. I'm going somewhere with this, I swear. So with the NutriFiber, I guess, where they're just like, oh, this is everything you need, and we put it in a thing. How good, like, what's the science on that now versus like maybe, I guess people say like making smoothies or shakes with like the stuff?
Yeah, so I mean, the deal is that if you're meeting your basic nutrient needs, you're gonna be fine, right? I have a lot of patients who have issues with food insecurity, who don't have insurance, who sometimes are homeless. And, for those people, it's not a matter of like getting organic kale or not. It's a matter of literally just getting something to eat and having someplace safe to store it. So there's always like different levels of like how healthy things are. But at the end of the day, like the nutrient is solid. It does the job it's meant to do. Nowadays, though, they do have different formulas. So they have some things called like real food blends or like liquid hope, where they're just like commercially made pureed foods. So if you wanted to like give your brother a pureed food, it's a lot of work. You have to cook it really well. You have to strain it. You have to package it, right? So you could buy that all packaged and then put it through a feeding tube, but it's super expensive right now. And I think our insurance in this country is absolutely disgraceful. And so it's really hard to get covered.
No, in America? Come on.
Now, if you were to fix insurance, how would you do it? And who would you kill first?
Who would I kill first?
Yeah.
I feel like that is counterproductive to getting
Whose life would you save?
whose lives would I sacrifice in order to save other lives?
Yeah. What celebrity would
Kill
you
one, save a
kill?
million.
What celebrity would you be willing to kill to get insurance for every American citizen?
Who would I sacrifice? Who's that one guy? Army Hammers.
Army Hammer.
Yeah,
I
get
would
rid of
think
that guy.
Hammers. Who's that guy?
Marine screwdriver.
I thought Army Hammer would be right up the valley.
Huh.
No, Air Force drill.
Air Force drill.
Air Force drill.
Yeah. Navy
Yeah.
French.
I think
Navy
we
Ranch.
need universal health. We just need universal health care.
What about galactic healthcare? Why can't we settle for galactic
Yeah.
or solar system?
I think universal is greater.
Most people would probably
It's
just
true.
want, a little bit of healthcare. Any help.
They-
I'm uninsured, baby.
Yeah.
Yeah,
Yeah.
that's not right.
You're a baby.
Yeah.
Yeah. Well, I turned 26.
I'm working on it. That's why I
Yeah.
have a degree in public health.
Speaking of baby, I was told that I'm more like Baby Spice. Which Spice Girl do you identify with?
I gotta say true. I've always been a sporty spice.
I knew you were gonna say sporty.
Ooh.
Nah, I was thinking sporty. You know who I am?
I think everyone's Baby Spice, but I think I need to dive in deeper.
I'm Ginger Spice.
No,
Oh.
No.
Who am I?
you're posh.
I'm posh.
Yeah.
I'm not scary.
No, you're a little pretentious.
You're like the manager secretly, filming.
I'll tell you what I want.
Sean,
whatever
who are
it is I
you?
want.
Which spice girl
it's-
are you?
I'm probably either Sporty Spice or Scary Spice. I'm not posh. I'm not Ginger.
No.
Whoever has the most attitude, which I think is Scary Spice. Mel
I
B.
wanna.
I don't know. I was born in the 90s, so I don't really know the Spice Girls.
God damn, bro.
Aw, I'm so sorry.
tell you
for
what I
your
want.
loss.
I know the one
Really,
song.
really, really want to zig a zig.
About Powerpuff Girls.
Powerpuff Girls are back.
Which
They're the
Powerpuff
same.
Girl are you?
They all like the same. No, actually, Bubbles is different. Bubbles is Baby Spice.
I'm Bubbles.
Yeah, you're Bubbles. I'm the red one.
That's Blossom.
Yeah,
Awesome.
I'd be the bossy one in that group.
I'm the monkey.
Mojo Jojo.
Mojo Jojo.
I am Mojo Jojo.
No, you'd be the gender non-conforming devil.
Oh, the devil. Yeah, the
Yeah.
sexy
Him.
cross-dressing devil.
I don't remember that one.
Yeah, you don't remember the devil who was either transgender or cross-gender, or it just went
How do you
by him.
How do you know
Yeah.
Powerpuff Girls, but you don't know Spice Girls?
That was in the 2000s.
I
Yeah, I
guess.
think they're a bit
Fair enough.
more
Things
recent.
that happened in the 90s, I remember. Things that happened in the early
I'm
2000s.
more of a Dexter's Lab guy than Powerpuff Girls.
Oh yeah, Dexter's Lab's amazing.
I
Same
would think,
creator.
Andrew, I would think you'd be really into like the Flintstones because those were around when you were a kid.
Okay. All right.
'Cause you're old. Like
Uh,
dating an 80-year-old man.
Don't Don't hate on his age.
So what's your
He's a lovely
favorite
senior citizen.
and least favorite ice cream?
My what?
Your favorite and least favorite ice cream?
My least favorite ice cream is my grandma's favorite ice cream, butter pecan. It's just, I don't like it.
It's okay.
Uh-huh.
I like it okay sometimes if it's
just-
good.
No.
There's a lot of like artificial flavoring butter pecan out there.
Yeah. And
Mhm.
then my favorite is, I'm like a mint chocolate chip.
You like mint chocolate
Good
chip?
one.
I mean, I know you like that
I
one.
like that one. But I
She-
also
she
like
likes the non-dairy Ben and
Mm.
Jerry's mint cookie more than the
So
dairy.
good.
I'm like, how can you like
I
the
don't know why,
non-dairy
but
more?
it's so good.
Nah,
it's
dairy's like on the way out in general.
Nah, it's so much better.
I'm starting to think. I'm
It's
starting to think
reflux.
I'm lactose intolerant.
Yeah.
Yeah.
We could do an assessment and find out.
Nah, I don't want
Yeah.
to. It's one of those things I don't want to find out. Like if I am like, but you can't die from it, right? It just gives you the shits.
Yeah.
Yeah.
I mean, it's not good to eat things that your body. Lactose intolerance is the easy solution. If you want to eat lactose, you just take lactase.
Nah, I'm not doing that either. I'm not doing an extra step.
I'm
Ah.
holding back a joke so hard right now.
I know. You
Yeah.
want to say something mean? Yeah,
No, it's not mean.
I can see it in your face.
It's not. No, it's whatever. Whatever. I hope I remember later
Don't
so I
do
can
it.
tell you guys. But
What are your guys' favorite ice creams?
my favorite and least favorite ice creams. Okay, here we go. My favorite one.
I like Rocky Road.
You do?
It's classic.
Good one.
Good one.
You know, apparently the name Rocky Road makes it taste better.
Really?
Rocky Road.
How
It's a
does
good
it-
name.
Probably does.
It's a great
It
name.
is a good
That's a
name.
great ice cream.
Yeah.
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 Like people who like eat that same ice cream, but the one's called Rocky Road,
You
the
know
Rocky
what?
Road tastes better. to
One
me.
of my favorite ice creams that I've ever had is Three Twins. There's this brand Three Twins. I think they stopped making this flavor. It's orange chocolate. But the thing they do so right that almost no one does is they shave the chocolate into really thin ribbons so it melts in your mouth. It doesn't like hard. It's not like frozen chocolate. It melts really quickly.
Okay.
Huh.
I like
So
that. Try
if you are a cancer patient, what's the best flavor of ice cream you could eat as a cancer
Chocolate,
patient?
mint chocolate chip.
No, probably not mint chocolate chip. I think people go to the classics when they're not feeling well. So like vanilla. Oh my gosh. For some reason, everyone loves coffee ice cream. That one, I always get a lot of people who eat
Mm.
coffee ice cream.
Yeah, but the thing
There you
is,
go.
mint is like a refreshing ice cream. And I imagine if you have cancer, you need to feel refreshed.
However, a lot of people have taste changes, so things taste funky.
Yeah, that's
Oh.
possible.
You know, like what the biggest taste change ever's been? Has
Mm,
it somebody been like, I hate chocolate, and then immediately love chocolate after getting cancer?
people
Yeah,
get,
that happens.
Really?
Yeah,
Huh.
yeah. The biggest change, I'd say, like the most common thing is meat. People lose their taste for meat. Meat tastes weird. Something like it tastes like metallic or cardboard, or people try to get people to describe it, and they'll just say it just tastes bad. Like it doesn't taste right.
Oh wow.
yeah.
So
Me
what
too.
if you have a vegetarian who needs protein, or someone who hates meat and has cancer? What sort of thing do you recommend for them?
Yeah, especially nowadays, there's lots of good stuff. There's lots of vegan and vegetarian protein options. There's a lot of foods that are fortified, or like there's high protein versions, which I think a lot of the stuff on the market is more designed for people looking for like high protein for weight loss. But I use them strategically for people who are just looking for higher protein. Like you could get high protein oatmeal, you could get high protein cream cheese, like weird things.
And for
Mm.
keto people and like paleo people.
Yeah, but I use them for my peeps.
Yeah.
Mm.
I think we should start wrapping this up because
Yeah, we're at the 40-minute mark. We can.
I'm exhausted. But Frankie, I want to know. I know Oscar had this question, and I think it's an important one. What takeaway do you want like people to know about nutrition, your job, people with cancer? What do you think people need to know?
And what about you in general? What do you want people to know about you in general? And
Well, that's a different question, and
I'm following. It's called the follow up.
Well, we didn't finish this one, so
What do we want people to know about nutrition? That it's okay to enjoy food.
yeah.
Okay, that's number one. And enjoy food, love food, stop feeling guilty about eating food. And that what else were what were the other
It's
questions?
about people with cancer.
People with cancer are badass. Don't feel bad for people with cancer. They want to be treated like human beings. They are human beings. They are doing some kick-ass freaking work to keep themselves healthy, basically save their lives. And
What about your job in particular?
about my job, it's hard. If you want to come be an oncology dietitian, please come join us. The national staffing ratios for oncology dietitians is one dietitian for every 2,000. It's a little bit over 2,000 cancer patients. So
Wow.
there's not a lot of us. And we also need this service covered by insurance. So Center for Medicare and Medicaid covers nutrition visits for people with diabetes or kidney disease, and people are lobbying right now to get it covered for people with cancer. So that's a huge thing that I think people need to know. If you're a cancer patient or know someone with cancer, get them to see a dietitian if they don't have one, because the staffing ratio sucks. So chances are you may not have access to one.
That's insane. Because I mean, that population really does need dietitians.
Yeah, especially with just the rising cancer rates in this country too. When you think
Yep.
about it.
Exactly.
Wow.
What was your follow-up, Sean?
I said, and what's something you'd like our listeners to know about you personally as we wrap?
About me personally,
Yes.
I love hula hooping.
I like pasta.
I like pasta.
I like
I
pasta.
like pasta.
I had some really good chicken parm tonight. Oh, I made a really good orange cake tonight with a whole orange in it, the rind and everything.
So good.
But that's not, I guess that's not about me. I don't know what I want people to know about me.
No.
That I don't know. I love my job. I really do. People always ask like, how do you do it? So sad. But I wouldn't do anything else in the world.
How you do? It's so sad.
Yeah.
Yeah,
All
it
right.
seems very rewarding.
You want to come be a dietitian with me, Oscar? I think you'd be great. Your baby spice energy could really make people feel comfy.
My diet is pretty atrociously terrible.
I mean, what? Do you think of Ben and Jerry's every night?
Yeah, that
too.
cigarettes, seltzer. Well, seltzer's fine.
Seltzer's okay.
Cigarettes.
You're not eating the cigarettes, are you?
Not all
You
the
said in your
time.
diet. Are you eating cigarettes?
Not all the time. Just sometimes.
Only on the weekends.
Yeah.
Cheat day.
All right, Frankie. Well, do you want people to find you? Do you want to tell people?
Nope.
Okay. Well,
catch me if you can.
if you have any Frankie related questions, I'll filter them.
Maybe
through
one
them.
day, not today though.
Yeah.
Yeah.
You can message me on my Instagram. And
I'm not ready to be found.
If people have cancer related or whatever important questions. All right. Well, that's been another episode of Knowledge Daddies.
Thank you for having me, guys. This was
Yeah,
fun.
well, thank you for coming. It was very interesting.
You were a great guest.
Thanks.
All right, everybody. We'll see you next week.
All right.
All right.
Right.